Welcome everyone to our Health Coverage Nearing Retirement in Maine webinar. My name is Brianna Henwart and I live right over in North Berwick and I specialize in Maine and New Hampshire. So if you are a Mainer and you are turning 65, you are looking at retirement and you're looking to get coverage outside of your employer to then get into retirement, you are in the exact right place. Medicare doesn't need to be confusing, and there are also options outside of Medicare for you or your spouse. Let's get you retired as soon as possible. So today we're going to talk about a couple different things. We're going to talk about the Affordable Care Act, and we're going to talk about Medicare. And that's really personal to me. So Tyndon Health and Wealth is my company, and I own it. But we were founded 18 years ago by my mom and dad, Tina and Don, thus Tyndon. But the big thing for us has always been about health. So my little sister, Bridget, who I care for, you'll see in this picture right here, was actually born with cerebral palsy, epilepsy, and autism. So she went on Medicare at age 20, and I was there. She moved in with me at 18, and she just kind of got shipped a Medicare card. It came in the mail one day, and we're like, what do we do with this? Fortunately, again, we've been doing this for years, so we know what to do, but a lot of people don't. So it's really personal to us. Healthcare is how you get access to care in the United States. So we need to understand all your options, and Medicare isn't optional. You paid in your whole life to this, and you deserve to get every second you can out of it. The second part of our company of Tyndon Health and Wealth is my husband. He's a wealth manager and financial advisor. So we help with all parts of retirement, from the health to the finances, to get you to the retirement that you want, know, and love and deserve. So today we're going to go over a bunch of information, take a bunch of notes, but I am only a phone call away to get you all the options you need. We also have an office at 655 Post Road in Wells if you want to come in and meet in person. Lastly, I have a 1.5-year-old little boy, Leo, so we are here for all stages of life. Health insurance is so important, and today we're going to get you all the information you need to make the best decisions for you and your family. So without further ado, there are two big points of health insurance: under 65 and over 65. If you're under 65, then you're most likely going to be using the Affordable Care Act. In Maine, we have what's called CoverME.gov. That's Maine's Affordable Care Act. If you go to healthcare.gov and click on Maine, then you're going to see CoverME.gov. Then it's going to work hand in hand, like a bit of a relay race, with Medicare when you turn 65. If you're on SSDI, or disability, for 2 years, like my sister, you can go on Medicare early. But in general, you're going to go on it at 65. So we're going to go over the other part first, the Affordable Care Act, and then if that's all you needed to know, then I can help you with that stage. But the second step is gonna be your Medicare. So I highly recommend you stick around so you get the full picture when it comes to your care. So CoverME.gov, when you're on that site, you're gonna see what's called an advanced premium tax credit. Essentially, the marketplace looks at your age and your income to determine what the cost of your coverage is gonna look like. That makes it really phenomenal for retirees. The closer you get to 65, the more savings you have. And oftentimes, when you retire, your income drops. So it ends up being a very good place to get your coverage. In Maine, we have 4 carriers: Anthem, Harvard Pilgrim, Community Health Options, and Taro. And it really depends on you and your needs what makes sense. I have someone on each and every carrier, depending on doctors, prescriptions, and just overall trust with the clients and the customer. So when we go into this, it's an interesting little dynamic. So the advanced premium tax credit, think of it like this. If you had a $400 plan, but because of your age and income, you qualified for a $300 advanced premium tax credit or subsidy, you're only going to be paying that $100 left over each and every month. Then, when you go to file taxes at the end of the year, because you do have to file taxes if you're going to be on the marketplace, that's when they reconcile that. If you said you were going to make $40,000, but you made $45,000, you're going to pay some of that tax credit back at tax time. Vice versa, if you said you were going to make $40,000, but you made $35,000, you're going to get more money back at tax time. And the good news is that you can go in halfway through. We can decide now what you want to put down, but then say July, you need to switch it up. We can go in there and change what you put down to then change the cost of your care. And that's the big thing. I don't go away. So if you need support, we can get to all the help you need. But this is a phenomenal way to get coverage outside of your employer for either you or your spouse before we turn 65. The last thing we want to recognize when we're at the marketplace is those 4 metal tiers. You're going to see bronze, silver, gold, and platinum plans. Essentially, a bronze plan, you're going to pay less per month, but you're going to have more copays as you go, higher deductibles. On the other side, you have platinum plans where you pay more per month, but have lower deductibles, lower copays. And it really depends on what your needs are. The last piece when you're looking at those metal tiers is if you are a lower income individual, you can also qualify for what's called a cost share reduction, or CSR. A cost share reduction means that they're not only giving you a subsidy or a tax credit to decrease the cost of your health care, but they're also reducing by a percentage the co-pays, the deductibles. So a CSR 87, you have an 87 cost share reduction. Those plans with CSRs are only silver. So if you have a CSR, your silver plans are probably going to be stronger than the gold and platinums and cheaper. If you have any questions on that, I am always around. Lastly, the marketplace has a no wrong door policy. What that means that if you go on to the marketplace and enroll and try to enroll in a plan, but your income is such that you would qualify for Maine Care or Maine's Medicaid, which is state-based coverage based on your income, they will automatically get you pinged over to DHHS instead of accidentally enrolling you in a plan on the marketplace. So there's never a fear about not getting the coverage you need. Medicaid or Maine Care is a phenomenal way to get coverage if you're a low-income individual. So, under 65, if you're low income, we're looking at Maine Care. It's that free state-based health care. If you are a little bit above that, then we're going to be looking at CoverME.gov. That's Maine's Affordable Care Act plans. It's a great, great resource. The second piece, for those of you that are now, okay, maybe you're 64. Maybe you're only going to be on the marketplace for 6 months. And then when you turn 65, again, we're going to pass that baton right over to Medicare. Medicare is that federal health insurance that you paid into your whole life. And it's a really easy transition to get you over there. And I will walk you through every part of that. However, Medicare is pretty different than the coverage you've had through your employer. The marketplace is pretty similar to employer-based healthcare. Medicare, there's a couple different moving parts. So Medicare has a couple different moving parts to it. Medicare is that red, white, and blue card, and it has 2 foundational parts of original Medicare. One is Medicare Part A. Medicare Part A is your hospital coverage. That has no monthly premium. It's $0 a month as long as you or your spouse has paid into Medicare for 10 years. The second part is Medicare Part B. Currently, Medicare Part B for most people is $185 a month, but that can be adjusted based on your income. If your income is below 250% of the federal poverty line, then you might be part of the Medicare Savings Program. That's when the state of Maine helps pick up the costs of your care. If your income is a little bit higher, then that's when we start talking about what's called IRMA. IRMA is Income-Related Monthly Adjustment Amount. And that's when, for high income earners, you start paying more for your Medicare's Part B and your drug coverage. So if your income is above, as a single individual, $106,000, or as a married individual, $212,000, you're going to pay more than that $185 a month. And Medicare also is looking at your income from 2 years prior. So in 2025, we're looking at 2023. It can get kind of complicated, especially for those of you that are retired, because it might have been 2 years ago, you were at the peak of your career. You were making great money, but now you're retired. Your income went down. If that's you, if your income has thus gone down and that 2023 or 2 years ago income is no longer accurate to your current income, then we're going to file a form called SSA 44. That's due to a major life event. We need to have Medicare or Social Security use a more current income, either this year or last year. If that's you, definitely take a screenshot of this. Definitely reach out so I can get you that form. Don't overpay for your Medicare just because you didn't file a single form. I got you. But moving on. Medicare A and B. That's your original Medicare. You're going to pay roughly $185 a month for that foundation. But how do you get enrolled? So if you are already drawing Social Security, you are going to automatically be enrolled in Medicare's Part A and B. 3 months before the month you turn 65, you're going to get that card in the mail. So my birthday is March 7th. So my Medicare is going to start March 1st. But I can enroll and I will get my card in the mail 3 months prior, so December. But a lot of people at 64 are not collecting Social Security. So if you're not collecting Social Security, then we need to manually enroll you in Medicare. We're going to do that one of 4 ways. You can do that on SSA.gov and just enroll directly on your login. I think that's the easiest. Or you can call them directly at Social Security. You can also go to your local Social Security office by scheduling an appointment with them. Or lastly, you can mail in an application to Social Security as well. I don't love the mail as much, but whatever works for you. So then you're going to enroll in Medicare's Part A and B. But because you're not drawing Social Security, they'll have no place to bill you. They won't be able to just draw that $185 out of your check. So instead, they're going to send you a quarterly statement of 3 months. So that quarterly statement is going to be, for a lot of people, $555. And you can pay that however you like. You can have it come out monthly. You do not have to pay it quarterly. But that's how you're going to get enrolled in Medicare. Now, some of you aren't going to have to enroll that quickly, which I'll explain. But your coverage is going to start the first day of the month you turn 65. Even if you're born on the 31st, your coverage starts on the 1st. If you're born on the 1st, it starts a month earlier. But the big thing is if you're still working and you have great coverage through your employer, you don't have to pick up Medicare's A and B. So if you're still working and your employer typically has over 20 people in their employer, then your coverage needs to be as good as Medicare. Thus, you don't necessarily have to pick it up. At 65, you have the option. Do you want to go on your Medicare, or do you want to delay and stay on your employer-based health care? If you stay on your employer-based health care, you're just going to need one more form saying you had incredible coverage the entire time when you do retire. It's super simple, and I can walk you right through it. However, the big thing I want people to recognize is just because your employer supplies health insurance does not mean it's cheaper or better than Medicare. You've paid into Medicare each and every paycheck. A lot of times, Medicare is stronger. So I highly recommend we sit down and put them side by side and compare all your options when it comes to Medicare. The biggest thing we need to recognize, though, is that Medicare is not complete. Just that red, white, and blue A and B is not all you need. There's some major exposures. So I'm going to go over the exposures. Don't worry about them too much, but I'm going to explain how people avoid them. It's pretty straightforward. But Medicare Part A, while it's nothing per month, it has a $1,676 deductible. And that's per hospital stay. So if you're in the hospital, you're going to pay the first $1,676. And then if you're out of the hospital for 60 days, it refreshes up to 5 times per year. So really not very full coverage. The second piece is your Part B. Part B has 3 other major exposures. The first one, it has a $257 deductible. Not terrible. $257, not too worried. But it also has a 20% coinsurance with no cap. So your doctor sends you $1 million doctor bill, you're going to pay 20% of that. So we highly recommend, we do not want to have a coinsurance with no cap. The last in Maine, because in Maine, it's actually not legal for doctors to charge that Part B excess charge. So our Department of Insurance has got our back there, but outside you might see it. Only 4% of doctors do that Part B excess charge, but it is an exposure. But that's okay, because we're going to cover all of that, how to avoid all of those exposures. Because the first decision you make when you turn 65 is, do I want Medicare? The second decision is, do you want to go Medicare Supplement or Medicare Advantage? Those are the two major paths that people take to get coverage and complete their Medicare coverage. Because we still need to cover all those gaps and get drug coverage. So there's two major paths, and neither path is wrong. At this point, the country is about 50-50 on who is on which path. So as long as you understand them and make the best choice for you and your family, you're solid. So the first path I'm going to go over is the Medigap, or Medicare Supplement path. On that path, you have Medicare Parts A and B. That's that foundation, that red, white, and blue. And then you have a Medigap plan, which the whole point of that plan is it is going to cover those different exposures we talked about. And then we're going to pick up a standalone prescription drug plan, that Part D. The benefit of that path is you have no networks. You have a really solid, like you understand what your copays are each year. There's no surprise copays. And you don't have to worry about, does my doctor accept this? Because as long as they accept Medicare, you're good. It's really straightforward. Bills just go to Medicare. Now, if you go into your Medicare Renew book, some of you will see this chart. I know, it looks confusing at first. Let me kind of break it down. So this chart shows all the different Medigap plan types. So there's A all the way through N. And on the left side, it shows all the different exposures. See those that Part A deductible I talked about, that Part B deductible. The most popular plan, and the one that I see that people love the most, is that Plan G. So if you go down Plan G, you'll see it's 100% coverage for anything inside the United States, except for that Part B deductible. So really, you're going to pay your premium, you're going to pay your Medicare Part B, you're going to pay once yearly $257, and then you're never going to see another medical bill, as long as it's Medicare covered. It is straightforward and it is solid. Second part, all the way at the end, is that Plan N. A Plan N, very, very similar. You have that $257. You could have a Part B excess charge, but again, we don't have that in Maine. And then you're going to pay a $20 copay for the doctor and a $50 copay for the ER. So it's really, really solid. The only difference between those two plans, Plan Ns are roughly $50 less per month. And in Maine, our Plan Gs are about $220 depending on the plan you pick, and a Plan N's about $170. Now we're going to go into exact details when you and I sit down, but it's really pretty fantastic coverage for what you're paying. So just one more second there. There's three parts to this path. You have your original Medicare, they pay first, bills go to Medicare. Second part, your Medigap picks up the rest, and then we pick up your Part D drug plan. It's solid, solid coverage. Now the big thing to recognize about Plan Gs is that it does matter a lot which zip code you're in. You might have friends that are in Mississippi or in Arizona, and they're going to have completely different options and completely different things around their Medigap than you. In Maine, we have one awesome thing happening with us, and that is our Department of Insurance. So in Maine, we have one carrier that is completely guaranteed issue. That means it doesn't matter what's going on with your life, what's going on with your health. If you have an election period to change your coverage, you can pick up that plan. We also have a 3-year look back. What that means is that if you're in another state, say New Hampshire, and you pick a Medicare Advantage plan to start off, but then you want to go to a Medigap later, you only have 12 months in New Hampshire to make that choice, or you are going to have health underwriting and could be denied. In Maine, we have a 3-year look back and one plan that's completely guaranteed issue. So we have so many more options in Maine than other states. However, due to that, our plans are double or close to it than other states. Our plans are a lot more expensive. So keep that in mind when you're talking to friends outside of the state about different plan options. You have more options than other states do, and that's what makes Maine an amazing place to retire. We also have household discounts. So if you and your spouse choose the same Medigap, you can get awesome discounts. So that's also another piece to keep in mind. So now that's your first path. That's Medigap. If you want most flexibility and you don't really care about paying more per month, we're going to go there. Your second option is your Medicare Advantage path. Now, Medicare Advantage is a little bit different. On Medicare Advantage, instead of Medicare paying your doctor directly, Medicare is going to pay a private health insurance company to be your coverage. It works very similar to your employer-based coverage, where you go in, you have different networks. There are HMO and PPO networks, and you pay co-pays as you go. Now, in Maine, we have 6 carriers. I work with all 6. So you can kind of pick which way you want to go, and it might change year over year. The plan can change, and also, your needs change a lot. Another awesome part about Medicare Advantage is they're able to cover things that Medicare doesn't, like dental, vision, hearing. A lot of times these plans are $0 additional per month, so you're only paying your $185, unlike on Medicare Medigap, where you're paying the $185 plus the $200 plus for your supplement. So it's going to be a really solid path for those of you that are younger and healthier and whose the extra benefit matters a lot too. They also have gym memberships sometimes. Some of them have these fancy wallets where you can get reimbursed for naturopathic doctors or all these other type of things. So we really need to nail down what your exact needs are before we pick a path. One other thing I want to mention is for those of you that are low income, those of you whose income is below 250% of that federal poverty line, there are what are called dual plans. You might see called QMB for qualified Medicare beneficiaries. In those cases, you not only have the federal government paying into your care, but you also have the state paying in. So those plans, you're often paying nothing per month and no copays, and you get the dental, vision, and hearing. So for those of you that are low income, that might be the best of both worlds. That's also where you see those advertisements for food cards, things like that. It's because you have the state picking up some as well. So to recap, Medicare Supplement versus Medicare Advantage. If you're going the Medicare Supplement path, you're gonna pay a lot more per month, but when you go to use your care, you're gonna pay next to nothing. Very, very little. You're gonna pay a bit more, but you can see any doctor in the country, no referrals needed. You can also choose a standalone prescription drug plan to go with it. Your second path, your Medicare Advantage path, you're going to pay a lot less per month, but you're going to pay copays as you go. You're usually just paying the $185 per month if you pick a $0 Advantage plan. But you have HMO and PPO networks. An HMO network means that if you're not in that network, and it's not an emergency, if you go outside of the network, you have no coverage. A PPO means you can go in or out of network. And in the Part D drug plan, your drug coverage is built in to your Medicare Advantage. You don't have to pick up anything separate, so that's kind of solid. So a little bit about all the different companies. So again, I work with every single drug company in the state of Maine. I also work with all 6 Medicare Advantage carriers and a ton of the different Medigap carriers. So I get to be your unbiased resource in this path. And I'm really proud of that fact. We have, for supplements and Medicare Advantage carriers in the state of Maine, we have 6 Medicare Advantage carriers. Anthem, Aetna, United, Humana, WellCare, and Martin's Point. And that's all of them. That's all 6. So it's a really interesting conversation. But oftentimes I have people who have these different myths about working with someone like myself, about working with someone like myself, working with an advisor. So they think, oh, I must have to pay a fee to work with you. And that's not true at all. You pay no fee of any kind to use my services. But then you think, okay, but nobody works for free, Brianna. So they must charge a higher price if you work with me. And that's also not true at all. You pay the exact same price, whether or not you just go alone and call an insurance company up randomly, or you work with someone like myself. And the reason is because the insurance companies love it. Studies have shown that when you work with an independent advisor like myself, you are 4 times happier and you stay on a plan 4 times longer. Because we actually sat down and we compared all your options. We actually sat down and looked at your exact needs and picked the one right for you versus, my neighbor said they loved XYZ insurance company. No, your neighbor's needs are not your needs. Let's sit down and make sure you're on the right one for specifically you. the last little myth I hear is if you get paid by the insurance company, you must have a bias towards one insurance company or the next. And that is completely untrue. My bias is towards you guys. I want to do what is best for you guys in every case. I work with over 25 different companies. So I see the ins and outs of them and which ones have the better or worse customer service. I get to see how the claims get billed. So I am 100% on your guys' side. So that's the big things that I do. No fee for what I do. I'm your free, unbiased resource, and you pay the exact same amount. So it makes no sense to not work with an advisor. You get tons of support. So the last little piece we need to bring up for your Medicare is that drug coverage. So that Part D. Part D is for drugs. Those are the drugs you bring home in those little pill bottles. Whether or not you get your drug coverage via the standalone with your Medigap or the drug coverage that's built in to your Medicare Part C Advantage plan, it works the exact same way. So let me kind of go into that. I won't try to bore you too much with the drug talk, but it's super important to understand. So in 2025, there are 3 stages to your drug coverage. The first stage is your deductible stage. So if your drug coverage has a deductible, you're going to pay that amount first. Oftentimes, I see small deductibles for brand name medications. So if you have a $200 drug deductible for your brand name prescriptions, you pay the first $200. The second stage is your initial coverage stage. On there, you pay a copay for each prescription as you go. And then the last stage is your catastrophic coverage stage. That's when if you pay in $2,000 towards your prescriptions throughout the course of the year, then you're done paying for the year. You still have drug coverage, but you won't have to pay any other copays. You have a $2,000 cap on your drug costs, which is pretty fantastic. Now, some of you are going to be on plans that are considered enhanced plans. On an enhanced plan, you're actually going to pay less than that $2,000. So if you have a lot of prescription drug coverage or a lot of prescription drug needs, you have some really expensive prescriptions like Eliquis, Ozempic, Jardiance, we might need to get you on a stronger plan so that you're not paying that $2,000. So I have a whole process to help you guys. So I have a intake form where I can take all of y'all's medications and I'll put it into my drug calculator, and I will with your exact pharmacy. So we can know exactly what you'll be paying each month for your prescriptions, so we can compare all the options in your zip code. It makes a big difference whether or not your prescription drug plan that you picked actually covers your medication. Every drug plan has different formularies or different drugs that they cover. And for example, you might have Humalog, but your plan covers Novolog. We need to know what prescriptions you're on so I can get you on the best plan for you. So that's my little method and methodology to make sure that your drugs are covered well. But some of you are looking at me and be like, okay, Brianna, that's fine, but I'm not on any medication, so I don't need a drug plan. Hold up, there was a huge penalty that we need to make sure that you're aware of. So there was a Part D penalty where if you don't have any drug coverage for more than 63 days, you're going to start accruing a 1% penalty for every month that you could have had coverage, but you didn't. So make sure that you have some type of drug coverage. There are incredibly affordable plans that you can just pick up to not get this penalty. And that 1% penalty is not 1% of your drug plan. That's 1% of the national average drug plan. And that penalty stays with you forever. So make sure you avoid this penalty by just picking up some type of coverage. If you have any questions on penalties, they're very easy to avoid. And I'll make sure that you don't hit that pitfall. The last piece to understand when we're looking at coverage is to kind of build your coverage house or your umbrella coverage. Health insurance is there for you and to make sure that you can get the coverage you need and avoid any concerns in retirement. And unfortunately, in retirement is when you get those big diagnoses that can really throw off your life. So I love this analogy because everyone's house is a little bit different. So we're going to build it to make sense for you. At the bottom, you'll see your major medical. That's your Medicare, that's your Affordable Care Act, that could even be your employer insurance. That's your foundation. That's what you use when you have your checkups and you have your prescription drugs. The next level of that is your cancer, heart attack, and stroke coverage. I have a huge belief in getting cancer, heart attack, and stroke insurance because the way it works is it pays cash directly to you. So a couple years back, my father passed of pancreatic cancer, and his $10,000 cancer policy came in really important because, yes, he had great Medicare coverage, and that helped pay for the ICU and the doctors. But when we had to fly in my eldest sister and her 2 kids who live in Japan, that isn't covered by insurance. A lot of things revolving around cancer, heart attack, and stroke, when you're actually fighting these diagnoses, are not covered by insurance. Hospital stays, flying in family, if there's any treatments that are more experimental. That's why these coverages are so important. They can also cover deductibles, co-pays, all those insurance co-pays from your prescriptions. Love different cancer, heart attack, and stroke policies, highly recommended. The third level of the house is you have your dental, vision, and hearing. If you are on a Medigap policy, that makes a ton of sense to get coverage for that. The fact that Medicare doesn't cover glasses doesn't make any sense to me, but it doesn't. And dental, vision, and hearing are not optional. The quality of life of having eyes that can see and being able to eat a steak is huge. But if you're on the other side, you're on a Medicare Advantage plan, and you have co-pays, a hospital indemnity can make a ton of sense for you because on a hospital indemnity plan, that's a plan that pays cash for you when you spend a day in the hospital. So I have one because I had a baby about 1.5 years ago. So when I was in the hospital, it paid cash to me. It made total sense. It was a great combination with my coverage. And I think it's like $22 a month sometimes for these guys. Highly, highly recommended. And then the roof of the house is your recovery care and home care. So Medicare does not cover long-term care. And long-term care insurance has become egregiously expensive. So a home health care policy does a phenomenal job because it allows you to age in place and be a way for your family members who are taking care of you to get paid for as well. So that's my whole little umbrella house coverage analogy. I think everyone's house is different, and so you get to pick what you need and what is your holistic picture. But oftentimes, just your major medical may not give you all the coverage you think it does and may not make you as comfortable in retirement as you want to be. So let's recap. If you're under 65 years old, you're going to use either MaineCare if you're low income or CoverME.gov, our Affordable Care Act. And that's a great way for you to get coverage for you or younger spouse. And then right as you turn 65, we're going to pass that baton from the marketplace over to Medicare. That's the coverage you've been paying into your whole life. You can also still have MaineCare, and MaineCare will wrap around your coverage. Once you're on there, you have your 2 paths. You have your Medigap path, where it's more per month, but it's more holistic coverage. Or you have your Medicare Advantage path, or Medicare Part C. That's when Medicare pays a private health insurance company to be your coverage. It has some extra things in there, dental, vision, hearing, those food cards. But you're paying co-pays as you go. So if you're sicker, it might not make as much sense. Now, there's a couple different stages to you right now that you're getting ready to retire or go on Medicare. The first stage is you're trying to get educated. You're trying to learn about all your different options so you can make the best choice for you. You can do that via this video is a great source. I have a newsletter, and I have other educational content as well. The next phase is it's time for you to get specific enrollment advice catered to your exact needs. And that's where I come in. So we can sit down, again, there's no cost to what I do whatsoever to you, and I get to be your resource, your unbiased person. And you'll also receive 2 bonus items from me. I have a personalized coverage roadmap that me and my husband made that it shows you exactly what to do throughout retirement. Again, we do all things retirement at Tinden Health and Wealth. We're not just your health piece. We understand your investments and wealth side as well, so we can give you that more holistic picture. And the second piece is we have a cost summary, so you can really know and budget into your care what this is gonna look like, specific to you and your exact zip code. The last piece is now you're our clients. You have free lifetime billing and claim services and free annual reviews with me. So that way you can have the exact coverage you need. And also, as time goes on, your needs change. In Maine, we just had a carrier leave a hospital system. So what that means is that a carrier no longer accepts this one insurance. And when my client called up the insurance carrier and was like, hey, I see you no longer accept my neurologist. What should I do? The insurance carrier told them, oh, change neurologists. My client has been with that neurologist for 20 years. I called her back, we talked together. I was like, do not listen to them. Do not change your neurologist to fit an insurance company. Change your insurance company to go see your neurologist. That's the important piece, and that is why it's important to have a carrier and an agent that works for you and can know that times change and adjustments change. So if that's you, make sure that you know that. So call now, click that gold telephone underneath this and schedule the call so that you and I can talk. I have a couple different times per week open. If you go on my calendar and there aren't any spots open, call me directly, we can get you scheduled. But click on there now and get on the schedule now so that we can talk and get the exact care you need. Again, my name is Brianna Henward, and I am the owner and operator of Tyndon Health and Wealth. It has been an absolute honor talking to you today, and I wish you a very happy retirement. I'll talk to you soon.